Hello again. Today we're going to continue our discussion of the peripheral nervous system by talking about the cranial nerves. Now I'm going to do this in two videos. So when we talk about the cranial nerves, let's review that our central nervous system is the brain and spinal cord. The peripheral nervous system are our cranial nerves and spinal nerves. Well, the cranial nerves, you have 12 pair of these nerves, and they're all associated with the brain. That means they originate on or near the brainstem area, not on the spinal cord. Most of these nerves are mixed. That means they have a sensory component, an information afferent going to the brain, or motor, efferent information output going out to a muscle or something that's going to have a response. A few of them are only sensory. They don't have any motor function to them, and we're going to talk about each one of these nerves and what they do. When you learn the cranial nerves, they each have a name and a number, and the numbers are Roman numerals, and so as you learn these, you need to learn your Roman numerals 1 through 12 and also the name, because on your exam I may use the name or may use the Roman numeral, so you need to know both, because clinically you have to understand both the number and the name. There's a couple of mnemonics out there to help you remember the names. This is one of them. You're welcome to go to the online Google and find some other mnemonics. There's also mnemonics to help you remember which ones are sensory and which ones are motor and which ones are both. So again, you're free, if you like mnemonics, to go and find some of those to help you remember the name and then their sensory motor or mixed function. So here's a diagram of the brain and the cranial nerves, and we have both the number and the name. Most of the names are very descriptive about what they do. The numbers, they number them from kind of top down. So the very kind of topmost nerve is the olfactory nerve. That's number 1. And you go toward the bottom, and that's where you get to number 12. So as you're learning them, you'll just say 1, 2, and you kind of work your way down the brain, down the brainstem, and you get your numbers that way. So again, make sure you pay attention to the name and number. Now, for your lab exam, I only expect you to be able to locate number 1, which is olfactory, and number 2, which is the optic nerve. The rest of them, I'm not going to make you identify on the lab test. The optic nerve is kind of cool because it makes this optic X, this optic chiasm. So chiasm. So chi is the Greek letter for X, so the optic Xism. So you can find number 1 and number 2 easily on a diagram for your lab test. So there's a chart in your book, and it gives you, again, the number and the name. It tells you, does it have a sensory component, does it have a motor component, or does it do both? So in this case, you've got yes, it does both sensory and motor. It also tells you if it has any parasympathetic fibers, and when we talk about the parasympathetic division of the autonomic nervous system, that'll make a little more sense later on. So again, this chart is really good. It kind of has everything you need to know in one place. So we're just going to start by going through each of the cranial nerves. I'm going to tell you what it does. I'm going to tell you how to test for it, and in some cases, what happens if something's wrong with it. So again, olfactory is cranial nerve number 1. These are cranial nerve number 1. And it's it's purely sensory, no motor, and it's for the sense of smell. And so when we get into our special senses, you'll know that you have some little nerve fibers that actually hang down from the olfactory bulb down through the cribriform plate of the ethmoid bone into the nasal cavity. And so when you smell, basically you dissolve chemicals that bind those receptors, and that allows you to smell. So to test if the cranial nerve is working, you would do a sniff test and see if you smell something. Now, if the cranial nerve is damaged, you'll have a loss of smell. Now, what if we put something astringent and you kind of jerked away so we know that you're smelling something, but you don't recognize what it is? Well, in that case, you may have some kind of brain damage. So, for example, some Alzheimer's patients, they can smell. Their cranial nerve is fine. They respond to the smell, but they have no recognition of what it is. So responding to the smell means that you have the cranial nerve is intact. Maybe not recognizing it could be a sign of some cognitive loss, some memory loss or recognition loss of the brain. Optic nerve is number 2, and here's your eye, and here's your eye, and it's got tracks that kind of come and they go this way, and then a few of them cross over, and you kind of come this way, and a few of them cross over, and they make that X right there, that optic chiasm, where is the X shape Real good landmark. When you find that, a lot of times it helps you find the pituitary if you're looking at a real brain. And it carries your afferent impulses. Again, it's only sensory, so your vision. So it's carrying the images that your eye is making into your brain, then your brain is able to figure out what that is. So again, we'll talk more about special senses and what the eye does later on. But to test this, you can use an eye chart and see if the person can focus. If you have damage to the optic nerve, obviously you would expect to have vision loss. Cranial nerve number 3 is the oculomotor. So this one tells you what it does. It moves something oculo, and so it moves the eyeball. It's a motor nerve, and it allows also to change the lens shape. So you've got some nerves that move your eyeball, and also the lens inside your eye is what's focusing the image onto your retina. We'll talk about that when we get to the eye. But you want to change the lens shape, and that helps you focus. So it helps you do that. So one thing that you can do is shine a light, and so if the pupil moves, then that allows you to know that nerve is intact. You can also follow an object, because again, the eye is moving. So shine light or follow an object would let you know that something might be going on with that nerve. Now this is, when you say the word lesion, so that just means something wrong. Okay, so if you have a cranial nerve 3 lesion, so this is the right cranial nerve 3 lesion, so there's a problem with the right cranial nerve. Okay, so remember, anatomically, this is going to be the right eye. So the right eye is deviated, because that means it's not able to get information to that medial rectus muscle, which is the muscle that helps move the eye. So when your cranial nerves, when you're talking about that, if the right eye has is deviated, that means the right cranial nerve has a lesion on it or something wrong with it. Your cranial nerves are ipsilateral. That means the right cranial nerves serve the right side, the left cranial nerves serve the left side. There's one exception, and I'll tell you that. But again, so when you're testing these, if you see a problem on the right side of the body with whatever cranial nerve that is, that means the problem is with the right cranial nerve. Cranial nerve 4 is the trochlear cranial nerve, and it is a motor nerve. And you have several eye muscles, the ones that allow you to move your eyes up and down and left and right. And this one innervates one of them, and it allows you to rotate your eye down and laterally. Okay, so you test it just like you test number 3. This one actually is a contralateral cranial nerve. It actually will innervate the muscle on the other side. So it's one of the few or the only exception to the contralateral ipsilateral cranial nerve rule. Cranial nerve number 5 is the trigeminal nerve, and it is both. It's a mixed nerve. That means it has sensory and motor. And so sensory is to the face, so you touch your face, and motor is to the muscles of mastication, your chewing muscles. So one of the ways you've got to test this one is to test it in 2 different ways. You've got to test the sensory part and the motor part. And so you can test the sensory by the corneal reflex, where you would try to touch someone's eye and they would blink, or put something warm or cold or painful or a prick on the skin, and that would allow you to know that that was working. Again, right side versus left side, you have to test both sides to see if both nerves are working equally. You can also have someone clench their jaw. So if you had a problem on the right side, this side would not clench as well as the left side. Remember, on cranial nerve 5, all 3, it's called the trigeminal nerve because it has 3 branches, so 1, 2, 3, and all 3 of these are sensory. The top branch goes to the forehead and the top of the head, or the top of the face. The second one kind of this middle part of the face, and the third one kind of all the way down through here. And there's a condition called trigeminal neuralgia, so basically inflammation of the trigeminal nerve, and this causes pain in the face. And I've never experienced it, but I've heard that it's extremely painful. Even to just barely touch your skin can be very painful. I've had something called occipital neuralgia, which is the occipital nerve that kind of comes to the back of your head, and I can tell you that even if you brush your hair, it'll send you into a shock of pain. So I've heard trigeminal neuralgia is very, very painful, so you have to take some anti-inflammatories and things like that to try to get over it. The third branch, the trigeminal V3 branch, is the only one that carries the motor fibers, and it's going to come down to the masseter and the temporalis, and so all of these muscles that play a role in closing your mouth and keeping your jaws clenched. So again, the third branch is the one that has the motor fibers as well as sensory fibers. Okay, well that's it. So we're going to move on to the next video, and we'll finish up the rest of the cranial nerves. Thank you.